We hear it all the time. Someone casually mentions they are so OCD because they like to keep their desk perfectly organized. But clinical obsessive-compulsive disorder operates entirely differently. It is driven by terrifying, intrusive thoughts that invade the mind without warning. The ensuing compulsions are actions performed out of sheer panic. The person desperately wishes the urges would stop, but the anxiety forces their hand. But imagine a mind that operates with extreme rigidity, an obsession with rules, lists, and order, and actually loves those traits. This is obsessive-compulsive personality disorder, or OCPD. It is a pervasive, lifelong pattern of intense perfectionism, a drive for work at the expense of relationships, and an unyielding demand for absolute control. Treating a painful psychological battle as a quirky personality trait actively masks the true nature and danger of both conditions. We end up ignoring the silent damage they cause. To understand how OCPD hides, we have to look inward at the architecture of self-awareness. Our brains constantly evaluate whether our own thoughts and urges actually belong to us. Psychologists categorize conditions based on how they align with a person's self-image. This dividing line is known as ego alignment, using terms like ego dystonic and ego syntonic. This diagram illustrates how OCD operates as an ego dystonic condition. The brain recognizes obsessive thoughts as foreign invaders striking the core self. OCPD, conversely, is ego syntonic. The brain views its unyielding rules as native programming, locking seamlessly into the person's identity. Because these traits feel completely appropriate to the individual, they experience no desire to change. They are fully convinced that everyone else in the world is simply doing things incorrectly. The ultimate danger of OCPD is not the extreme behavior itself. It is the brain's terrifying ability to disguise a mental illness as a core identity. If we map this out across an adult timeline, these traits initially look highly beneficial, especially in a professional environment. Modern corporate culture actively rewards the early stages of OCPD. Employers consistently praise the relentless workaholism, the flawless organization, and the uncompromising moral standards. Eventually, this dedication tips into pathology. The individual becomes entirely incapable of delegating tasks, believing no one else can meet their standards, and they develop an extreme inflexibility regarding ethics and routines. The breaking point arrives when the system can no longer sustain itself. The condition finally surfaces as severe burnout, co-occurring depression, or the total collapse of their closest personal relationships. The tragedy here is the silence of the disorder. It goes completely undiagnosed until the collateral damage to the individual's life becomes impossible to ignore. In a clinical environment, this presents a massive hurdle. You are trying to treat a condition that the patient does not initially believe is a problem. Casual advice from friends to just relax completely fails against a pervasive, lifelong pattern of neural rigidity. Real relief requires evidence-informed treatments. Clinicians utilize psychodynamic therapy, cognitive behavioral therapy, and schema therapy to break down these rigid structures and address the intense, co-occurring anxiety. Effective treatment is never about learning time management. It requires untangling a person's intrinsic self-worth from their compulsive need for absolute control. Properly distinguishing between an intrusive disorder and a deeply rooted personality pattern requires the expertise of a licensed clinician. Coping and Healing Counseling offers that expert therapy. Their diverse, culturally competent team includes licensed clinical social workers, professional counselors, and marriage and family therapists serving individuals, couples, and teens over 13. They deliver care through a 100% HIPAA-compliant telehealth platform, making their services accessible across all 159 counties in Georgia. They also remove financial barriers to treatment. They accept major insurances, including Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana, while offering a $0 copay for Medicaid patients. You do not have to let an exhausting need for control dictate the rest of your life. Reach out to Coping and Healing Counseling today to begin the healing process.